It's clearly a disease which is associated with social deprivation. I don't think anybody denies that that is the most significant factor relating to the condition. So if a vaccine were to be shown to be effective, it would be the Holy Grail for finally eradicating this condition in Australia and New Zealand. Rheumatic fever and rheumatic heart disease were very common around the world. Those rates have dropped away significantly, and the question you have to ask is why have they dropped away significantly? A lot of that is around the better delivery of health services, removal of the social deprivation factor in those countries that now never see a case of rheumatic heart disease. The likes of the US and the UK, for instance, you can talk to a GP and they've never seen one in their entire career. Whereas 50 years ago it was reasonably common.
In the 20th century, all of Europe, people had rheumatic heart disease. In Melbourne in the 1930s, white Caucasian children were filling the wards with rheumatic fever, and that's all gone away. It just happens at the moment in New Zealand, it's Maori and Pacific people who are getting the rheumatic fever. So there's probably something in the human genome that makes someone at risk, but it's probably the social living conditions that are the bigger factor than the genetic factor. Research is very important because we don't know the answers. So primary prevention, for example, it has been successful in Cuba, in the Caribbean, even in the United States of America. But the components of it, was it the sore throat swabbing, was it the public awareness, was it better, were the health professionals more aware of rheumatic fever? The individual components of that is very hard to tease out. And I think New Zealand's taken the bold step of just implementing a primary prevention program. And it's scientifically hard to sort out. And other countries will be looking at it very carefully, especially if it is successful to reduce rheumatic fever. So the more it's documented, the more scientifically you approach it, then it's of more use both in New Zealand to continue and in other countries.
Listen to your heart rate then. This is what your heart sounds like.
We know what causes rheumatic fever is a Group A Streptococcus. If we could eliminate Group A Streptococcus, there would be no rheumatic fever. But how we get there, we haven't yet answered.
One of the things that makes Streptococcus very difficult to make a vaccine against is that there are hundreds of different strains of Streptococcus. So an individual can be exposed to one strain and develop immunity to that strain, but then be totally susceptible to another strain that they might encounter the following week or month. And therefore, because there are so many different strains, it takes a long while to develop immunity to all of them.
One of the other issues we have faced with the vaccine is around safety. One of the critical questions that has been probably around for the last 50 years when people started to develop vaccines against Group A Strep was the potential for the vaccine itself to cause the disease. So there's been a lot of questions asked about whether these vaccines are likely to generate an autoimmune response themselves. And the last thing we want to do is develop a vaccine which is going to increase the rates of rheumatic heart disease and rheumatic fever rather than reduce it.
People have been trying to make a vaccine for Streptococcus for a long while. There's been a lot of progress in recent years, and our laboratory has been testing a novel approach to a Streptococcus vaccine which we're putting into a human trial.
If the vaccine proves not only to be effective but also safe, then of course a vaccine which is primarily designed for adolescents and children then has to go through another clinical trial which focuses on whether it develops the right sort of immunity in adolescents and children, and of course is safe.
I'm very confident that a vaccine will be created because we know more and more now about the biology of the organism and how it avoids natural immunity than we ever did before. Australia and New Zealand are working very closely together on a vaccine. Our Indigenous populations in both countries suffer very high rates of streptococcal pathology, and the governments of Australia and New Zealand are committed to developing this vaccine.